Let's get back to the story we're watching. It's developing out of Mexico, the outbreak of a respiratory illness that has been deadly. It's killed 20 people so far. Dr. Alison McGeer is one of Canada's leading infectious disease specialists. She's the Director of Infection Control at Mount Sinai Hospital in Toronto, and here to talk a little bit more about what we're learning from Mexico. Thank you for coming in. Public Health Agency of Canada has issued an advisory so far. What have you heard in your hospital?
Well, there's been advisories at the federal level and at the provincial level in Ontario, which is as it should be. And what we know at the moment is that there has been apparently an outbreak in Mexico. The Mexican authorities are apparently saying that they have detected influenza in this outbreak, and most of the rest of the country is having a bit of a late season surge in influenza, which happens, and so it makes sense. And I think the general assumption is that's probably what it is. We tend to think of seasonal influenza as not a very serious illness, but if you test more for it, you actually find out how many people it kills. So that's the working hypothesis about what it is. But in the meantime, our piece of the global surveillance that will allow us to be sure about what it is to be watching for travelers, to be testing people who have traveled to Mexico and have acute respiratory illness, so that in a week or two, the World Health Organization can put it all together and say, okay, that's what it was. This is what we need to do now.
Okay. There was some talk that this was maybe some mutant form of the flu, that they do have a good vaccination program in Mexico, but somehow there might have been some transformation. But is it possible that it's something wholly new that we're hearing about?
Sure. This could be the beginning of the next pandemic, in theory. It could be a whole new virus. Neither of those things are likely. You know, we've only had one new respiratory virus that did this kind of thing in the last 300 years. That was called SARS.
Yes,
okay,
you lived
doesn't happen
rather
often,
closely,
okay?
right?
It's not what we're hearing from Mexico about mixed respiratory viruses. The fact that there's been nothing new in 5 or 6 days. Those are things that make it less likely to be the pandemic. But obviously this alert system functions because, you know, what we found out during SARS was we weren't fast enough on our feet detecting it, and these viruses move very quickly. So this is us watching the new system for global detection and global warning working, and it's not working as well as we'd like because we haven't got the information out of Mexico as fast as we'd like to have
Seems like
but it's still working. Okay,
they had a number of deaths before they actually began talking about this. So give me some advice for Canadians, people who'll be watching. If they've just come back from Mexico, what should they do?
Well, I think, you know, respiratory illnesses have a short incubation period. So the expectation is if you've been back from Mexico for more than 2 weeks, you're fine. Okay, you get a respiratory illness, it'll be whatever's going around, you don't have to worry about it. If you've been back for less than 2 weeks and you develop an influenza-like illness, so fever and respiratory symptoms, then it makes sense to go to your doctor and say, hey, you know, probably isn't anything, it almost certainly isn't, but at least until somebody tells us we don't have to worry anymore, these are viruses we want to collect. So it's most of the illnesses in Mexico have not been serious, although there's been a range of illness apparently, and some people have been very ill. Most of them have not been serious, so people shouldn't be that worried about it. But what we do want to do is identify if there's some new virus, and the way to do that is for people to get a test if they get a respiratory illness, but it's really only in the first few days after you've come back.
And what about if you're thinking of going to Mexico? Should you rethink your travel plans?
No reason to stop. We're not sure where this is in Mexico, but it's not in the tourist area. We're not talking about the involvement of people who have traveled to Mexico. And you should, of course, have your flu shot before you travel anywhere.
Good thought.
And you should be careful to wash your hands. But your big risk from going to Mexico is diarrheal illness still at the moment, not any other new viruses.
All right, Dr. McGeer, thank you so much for coming in.